An interesting aspect of learning medicine and being in the medical field is that it involves learning a new language. In this first video in the Behind the Scenes series, we'll start by learning some medical terms that are used in practice every day. Hey everyone, my name is Dr. Graham Dersnah. Welcome to Bite Size Medicine, your go-to channel for short, easy to understand videos about the common medical topics that matter to you. If you're new, make sure to subscribe, get involved in the comments, and check out the description below for links and resources. Let's get started. This series is called Behind the Scenes because the videos will cover topics ranging from how to become a doctor, the daily life of a resident, how to suture, and more. This video will introduce several terms you may have heard while visiting a hospital or clinic or heard on TV, and many medical terms originate from Latin. Let's start with some terms related to timing. The first is one I think most people will recognize, which is stat. Stat comes from the Latin term statin, which means immediately, and that is exactly how it's used in medicine. When a test is ordered stat, it means we need the results urgently, as they may change the care we provide to the patient. For example, when a trauma patient comes to the emergency department, they may need a CT scan ordered stat to jump to the front of the line to determine what injuries they may have and whether or not they need surgery. The next few terms relate to how often something happens. These terms include PRN, BID, TID, and Q. PRN stands for pro re nata, and it means whenever it is needed. For example, if you take pain medication only when you have a headache, you are taking it PRN. BID stands for bis in die. This means 2 times per day, usually every 12 hours. TID, or tur in die, means 3 times per day, usually every 8 hours. And finally, Q stands for queque, and in medicine it means every. So for example, to take a medication Q 4 hours means to take it every 4 hours. The next several terms relate to how something may enter our body. PO means per os, which is by mouth. IM is intramuscular, meaning an injection into a muscle. IV is intravenous, through a needle into our vein. Topical means applied to the skin, while subcutaneous, or sub-Q, means injected just under the skin. IO is intraosseous, meaning injected directly into a bone. Buccal means absorbed through the cheek. Sublingual means absorbed under the tongue. Inhaled is to breathe it in. Rectal means to insert into the rectum. Vaginal means to insert into the vagina. And intrathecal means to inject into the spinal canal. That's a lot of terms, and there are so many more. What other terms are you interested in learning about? Before you go, make sure to like, subscribe, and leave a comment. Let me know if you enjoyed the video, learned something new, have any questions, have a personal experience in this area that you'd like to share, or have ideas for a future video. Thanks for joining me, and I'll see you next time for another delicious bite of medicine.